We should all be concerned about the numbers ticking up.
With COVID cases on the rise among kids, help could arrive as soon as next week. In fact, the FDA is set to approve the vaccine for kids yet at ages 12 to 15.
And Brandon, it can't come soon enough because we are seeing a sharp increase in the number of young people getting sick with COVID right now. Jared has more on the plans to approve the vaccine, but first, investigative reporter Morgan Lowe is live in the newsroom with more on the concerning spike in cases when it comes to our kids. Morgan.
Yeah, yet public health officials say they're seeing a more contagious strain of the virus that's infecting more younger people, including thousands of children here in Arizona.
There are so many different things happening all the time. At the same time, it's hard to tease out what's going on.
But there is something going on, according to Heather Ross, who is a clinical assistant professor at ASU's Edson College of Nursing and Health Innovation.
We should all be concerned about the numbers ticking up.
According to data from the American Academy of Pediatrics, which has been tracking the number of kids with COVID infections since the beginning of the pandemic, the number of children across the country with COVID increased by nearly 80,000 between April 15th and April 22nd. That was 21% of the new cases. In Arizona, the number of child COVID infections rose by 2,236 that same week. Meantime, Arizona Governor Doug Ducey rescinded his order requiring students to wear masks in schools. And now the state's largest school district, Mesa, as well as other districts and charter schools, are making mask use optional.
We're at a point right now where adults are being vaccinated, but we don't really have things in place for children.
Carrie English lost her 12-year-old daughter in January to a rare inflammatory reaction that occurs in some children who have been exposed to COVID.
As in my daughter's case, she had absolutely no symptoms and was in our household with us.
You had no idea that she had it?
None at all. She had 0 symptoms.
Elizabeth English had no pre-existing conditions. She was a healthy, active cheerleader.
This entire community was completely rocked by my daughter's death, completely. So many people affected by it because she was here on a Friday and gone on a Wednesday.
Elizabeth is one of 29 children who have died in Arizona after catching COVID. Our state ranks second behind only Texas in the number of child deaths.
How do you react when people say it's not that many kids?
I would challenge people who say it's not that many kids to look in the eyes of a parent who just buried a child and tell them it's not that many kids, it's not a big deal.
There is some evidence that the B.1.1.7 strain of coronavirus is infecting more children through group activities and sporting events. Not necessarily on the field, but through the activities before and afterwards, like riding in cars and team gatherings. Yetta?
That is so sad. What a sad story for that mother. Morgan, thank you.